Hey everyone, welcome to Anatomy in Action today. We're diving into the anatomy of the human upper limb with 20 multiple choice questions. Whether you're a medical student, a curious learner, or prepping for an exam, this video is for you. We'll keep it quick, fun, and packed with knowledge. Let's get started. We'll go through 20 MCQs, each with 4 options. I'll read the question, give you a moment to think, then reveal the answer with a quick explanation. Ready? Here we go. MCQ 1. What is the most proximal bone of the upper limb? A. Radius. B. Humerus. C. Ulna. D. Scapula. Answer. B. Humerus. Explanation. The humerus is the bone of the upper arm, connecting the shoulder to the elbow, making it the most proximal bone of the upper limb. MCQ 2. Which muscle flexes the elbow joint? A. Triceps brachii. B. Biceps brachii. C. Deltoid. D. Pectoralis major. Answer. B. Biceps brachii. Explanation. The biceps brachii is the primary flexor of the elbow, located on the anterior arm. MCQ 3. What is the primary function of the rotator cuff muscles? A. Flexion of the elbow. B. Stabilization of the shoulder joint. C. Extension of the wrist. D. Abduction of the fingers. Answer. B. Stabilization of the shoulder joint. Explanation. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, subscapularis, stabilize the humeral head and the glenoid cavity. MCQ 4. Which nerve innervates the deltoid muscle? A. Radial nerve. B. Median nerve. C. Axillary nerve. D. Ulnar nerve. Answer. C. Axillary nerve. Explanation. The axillary nerve supplies the deltoid, enabling shoulder abduction. MCQ 5. The carpal tunnel contains which nerve? A. Radial nerve. B. Median nerve. C. Ulnar nerve. D. Musculocutaneous nerve. Answer. B. Median nerve. Explanation. The median nerve passes through the carpal tunnel, and its compression causes carpal tunnel syndrome. MCQ 6. Which bone articulates with the clavicle at the acromioclavicular joint? A. Humerus. B. Scapula. C. Radius. D. Ulna. Answer. B. Scapula. Explanation. The acromion of the scapula forms the acromioclavicular joint with the clavicle. MCQ 7. What muscle is the primary abductor of the arm? A. Supraspinatus. B. Infraspinatus. C. Teres major. D. Latissimus dorsi. Answer. A. Supraspinatus. Explanation. The supraspinatus initiates arm abduction before the deltoid takes over. MCQ 8. Which artery supplies the forearm? A. Brachial artery. B. Radial artery. C. Ulnar artery. D. Both. B and C. Answer. D. Both. B and C. Explanation. The brachial artery branches into the radial and ulnar arteries, which supply the forearm. MCQ 9. Question. What is the name of the joint between the radius and ulna distally? A. Proximal radioulnar joint. B. Distal radioulnar joint. C. Elbow joint. D. Wrist joint. Answer. B. Distal radioulnar joint. Explanation. The distal radioulnar joint allows pronation and supination of the forearm. MCQ 10. Which muscle extends a wrist? A. Flexor carpi radialis. B. Extensor carpi radialis. C. Pronator teres. D. Brachioradialis. Answer. B. Extensor carpi radialis. Explanation. Extensor carpi radialis is a key wrist extensor located in the posterior forearm. MCQ 11. The anatomical snuff box is bordered by which tendons? A. Flexor pollicis longus. B. Extensor pollicis brevis and abductor pollicis longus. C. Flexor carpi ulnaris. D. Extensor carpi radialis. Answer. B. Extensor pollicis brevis and abductor pollicis longus. Explanation. These tendons form the lateral border of the anatomical snuff box. MCQ 12. Which nerve is affected in cubital tunnel syndrome? A. Median nerve. B. Ulnar nerve. C. Radial nerve. D. Axillary nerve. Answer. B. Ulnar nerve. Explanation. The ulnar nerve is compressed at the elbow in cubital tunnel syndrome. MCQ 13. What is the primary action of the brachioradialis muscle? A. Supination. B. Pronation. C. Flexion of elbow. D. Extension of elbow. Answer. C. Flexion of elbow. Explanation. Brachioradialis is a strong elbow flexor, especially in a neutral forearm position. MCQ 14 question. Which bone is commonly fractured in a fall-on? An outstretched hand? A. Humerus. B. Scaphoid. C. Ulna. D. Clavicle. Answer. B. Scaphoid. Explanation. The scaphoid, a carpal bone, is prone to fracture in such falls. MCQ 15. The median nerve innervates which muscle group in the forearm? A. Extensors. B. Flexors. C. Abductors. D. Adductors. Answer. B. Flexors. Explanation. The median nerve supplies most of the anterior forearm flexors. MCQ 16. What structure stabilizes the head of the radius? A. Annular ligament. B. Interosseous membrane. C. Ulnar collateral ligament. D. Radial collateral ligament. Answer. A. Annular ligament. Explanation. The annular ligament encircles the radial head, stabilizing it. MCQ 17. Which muscle adducts the arm? A. Deltoid. B. Pectoralis major. C. Supraspinatus. D. Infraspinatus. Answer. B. Pectoralis major. Explanation. Pectoralis major is a key adductor and medial rotator of the arm. MCQ 18. The radial nerve innervates which muscle? A. Biceps brachii. B. Triceps brachii. C. Flexor carpi radialis. D. Pronator teres. Answer. B. Triceps brachii. Explanation. The radial nerve supplies the triceps, enabling elbow extension. MCQ 19. Which joint allows shoulder abduction? A. Acromioclavicular joint. B. Glenohumeral joint. C. Sternoclavicular joint. D. Elbow joint. Answer. B. Glenohumeral joint. Explanation. The glenohumeral joint is the primary joint for shoulder movements like abduction. MCQ 20. What is the most commonly dislocated joint in the upper limb? A. Elbow joint. B. Wrist joint. C. Glenohumeral joint. D. Acromioclavicular joint. Answer. C. Glenohumeral joint. Explanation. The shoulder's glenohumeral joint is prone to dislocation due to its mobility. And that's all 20 MCQs. How many did you get right? Let us know in the comments. If you found this helpful, give us a thumbs up, subscribe, and hit the bell for more anatomy videos. Thanks for watching, and see you next time.